how do you determine what is going in your mouth daily, twice a day, versus what is in the shot? Like, how do guys know that if they get a hold of you or they want to do the oral thing, because now all of a sudden this sounds better, are they still getting the same amount that their doctor has given them once a week?
So it's not an apples to apples conversion because again, it's going into your lymphatic system and that's how it's being absorbed. But generally there's optionalities on the oral too. So if you can start at a dose and see how that's working after a couple weeks, and then if you need to, you can always go up or go down in dosage. So it's very flexible depending on how you respond to it. And most patients, I mean, 75% of our patients from our clinical trials were on, this was called either 300 milligrams BID or 400 milligrams BID. And that dosing seems to work for the overwhelmingly majority.
And are they seeing the same results as doing the injectables, which are all of a sudden they're getting more muscle mass, they're feeling better, they're having more libido increases, as opposed to just seeing it within the blood work?
Right. So symptomatically, we've seen statistically significant changes in a lot of those outcomes, right? Whether it's energy, mood, sexual encounters.
Mhm.
So based on the data and anecdotally what we've seen in a lot of patients, yes, you're seeing that. The one exception I'll say is if the guy is used to, again, very high levels of testosterone and he's been doing that for a very long time,
Mhm.
that's just a different animal, right?
Right.
And you probably, that's not necessarily the right patient for oral, I think.
Okay.
But when we talk about
You mean because they like that surge of it, and you're not going to
exactly,
get that with the pill,
yeah,
with
you're
one.
not, I mean, you will feel different. Again, you feel your energy, you feel better. So I don't want to say that you don't, but I think there's probably 10% of the population that fits into that bucket where they need that very big surge and they're just looking for something else. That they're probably gonna have to stay on injections.
Yeah. Why do you think that testosterone got such a bad name or a bad rap for so long?
So I think, I mean, a couple things, right? One was definitely sports, right? So testosterone is actually a controlled substance, and this happened in 1990. It's the only hormone that's controlled, and it happened after the Olympics. So Congress actually went ahead and scheduled testosterone, and then we continue to see things, right? Steroids in baseball and so forth. Even though testosterone is only a small component of these doping protocols, it's really not the driver, I would say. But that gives it a bad rap from that perspective. The second is also sort of the societal like categorization of testosterone, right? Like this male hormone, crazy sex drives, and like masculinity. I think that all got rolled up into one, and testosterone as a therapy has become sort of the fallout, if you will, right?
Mhm.
So I think the societal sort of norms around it have impacted it. And the last one I'll say is traditional medicine, right? Traditional medicine is not really taught on hormones. So when you go to your doctor, I go to my doctor, primary care, that's not the first thing they're looking at, or it's often they're never looking at it, right?
Mhm.
To understand what is happening. But the interesting thing is definitely on the male side, testosterone as a blood test, right? It's very simple, it's cheap, you can take it alongside your cholesterol, all your other stuff. It is the single best biomarker into your overall health because it will tell you your state of inflammation. You'll have an idea if you're in an inflammatory state. It will tell you more about your glucose control and your insulin sensitivity. It does tell you about your cardiovascular and your endothelial health if it's low. So for something that is so telling and so can be so easy, it's really surprising. It's just not checked more.
Right. And so, why are doctors not prescribing the oral as much as they are the shot, do you think?
I think it's purely an education bit, right? So
Right.
it's one that this exists, and we have to go out there. Remember, like doctors are notoriously, regular doctors, if you will, are notoriously hard to reach, right? They're running very busy practices. They don't really spend as much time sort of learning about the new therapies because the business of medicine has changed, and I don't blame them, frankly, because they that's how practices have had to adapt to survive, right?
Mhm.
They don't have this 1 hour with a patient, right? That's gone. So subsequently, yeah, they don't have hours to keep up with everything. I get it. They have to practice the way that they were taught.
Right. So is your product available right now and your doctors are using it and prescribing it?
Yes, so it's available right now. We've spent considerable more time. We started with academics and urology because
Uh-huh.
that sort of gives you that um, leadership perspective, right? If we have Cleveland Clinic is using it, Mayo, Baylor, UCLA, right? These Sloan Kettering, these are massive institutions that are using the product. So that's really where we started. And then we've moved more into concierge medicine, longevity, and the areas that they really understand how important testosterone is. So it's already part of the treatment protocols. Um, and then next is kind of currently right now, we are moving our way back into traditional medicine, whether that's through, endocrinology or primary care and trying to educate folks there on one, again, why they should be looking at testosterone, and two, Kaiser as an option.
Yeah, and I want to get a little bit more thought from you on why testosterone is so important in people's medical regime. You've said this isn't about adding years to your life, but adding life to your years. What does that mean to you?
So it's really about, again, that is the major portion of longevity to me. So being active, being, both cognitively and physically, being able to pursue the activities that you want to into, your later years.
Right.
That's really the key here. And you can't do that with hormones outside of sleep, nutrition, exercise, and stress being foundational items that are non-negotiable. Hormones, if you look at a longevity pyramid, are effectively the next layer. Nothing else is going to work properly if your hormones are out of whack.
Right. Right. That's what I've heard over and over again for women, especially again going through this menopause stage in their life. But it's more than that. It's before it, it's after it, it's continuing it, and the same thing with men. You guys don't have that one period in your life, so it's something that I feel like men forget about, or all of a sudden become overly obsessed with it. Do you know what I mean?
Yeah, either you're
Overly
not paying
obsessed
enough
with getting
attention.
fit later in life or something.
Yeah, you're either not paying attention to it, so it gradually like sneaks up onto you, and that becomes your new normal. So
Yeah.
that's the other issue with only looking at symptoms and not testing is a lot of people don't realize like the state you're in. It's sort of like, again, when you're gaining weight, you don't really realize how much until it's way far past, and your clothes absolutely don't fit you, right? Like these are all gradual scales.
Yeah.
So I think the same thing comes to hormones and how you're feeling. And then you forget how
Yeah.
good you could feel or how you should feel. And that's sad, frankly.
Yeah. And by the way, I mean, I've been living with my fiance, I guess, a year now, and I notice when he takes a shot, but I'm
Hmm.
going to tell him about your oral thing for sure. But he takes a shot once a week. When he doesn't take it, I notice within a week or whatever, it very much works very quickly. And I don't know if it's just him or that is what testosterone does in men. I've been
It's in
putting
your
on the
body.
cream for a year. I haven't noticed a bit of a muscle on me. He walks in 2 weeks later. I'm like, holy shit, what have you been doing? Because he has the line down his arms and he's like jacked. And he's like, I didn't do anything. I took the shot. So it is fascinating what it can do for the people that it works well in their body.
Absolutely. Yeah. And again, it's about finding the right levels too. So that's why I'm a big advocate for testing, even at younger ages, right? Say you start testing yourself at 30 and you may not have symptoms or anything like that, but at least at 30, you understood as an individual what your ideal level might have been, right?
Mhm.
So when you're 40, 50, and 60, if you need to optimize or if you need to restore, you have a better idea of where you were as an individual prior to that. And
Right.
that's important.
Right. And can you express that it's never too late also? Like you can get on this program and this path and it can help you now.
Yeah, absolutely. Again, this all the your body is quite resilient and smart, right? So the second it realizes that it's getting what it needs in terms of, let's call it, fuel, right? And testosterone being that in this discussion, then it starts adapting. The genes start turning on. They're not lost and totally forgotten. They're just dormant, if you
Yeah.
will. And they can turn on very quickly.
And just quickly for people that I know have asked me to ask you about what your thoughts are about pellets. So what you do versus pellets, why not a pellet?
So pellets serve, again, there's different reasons they exist for different patients, but two main things when it comes to pellets. One is the good thing is it allows people to sort of set it and forget it.
Right.
So they can get it in and then they don't have to remember it's not part of the routine and so forth. The real downside here is that it's not physiologic, right? Again, you're producing your testosterone every day, and pellets are giving you these extended high levels, even more so than that injection is giving you for that 1 week. Imagine it's giving you this. This is a multi-month period, right? So you're often again having these super physiologic levels, and that's just not how your body produces. So the side effect profile is going to be greater. Um, and then again, you also have like in today's day and age, you have this minor procedure. You're going to have scars all over your rear end for the rest of time. And then pellets also often come out. They extrude from those incisions and pop out, and you can't exercise for a week, right? So there's a lot of things that really don't make it conducive to most patients thinking about hormone therapy.
Right. What's the next frontier for this? Like, where do you see hormone health going in the next decade?
So two main areas in terms of where it's going. One is it comes back full mainstream,
Mm,
right? So this is both on the male and female side. Hormone health is going to be like a non-negotiable when people are looking at their overall health and well-being. It's
mm,
going to be in your blood panels. It's going to be checked regularly. You're going to have your doctors understand it and treating it properly. So I think that's going to do wonders for patient health overall, right? Like well-being of our society and how they're doing in terms of, again, how they're feeling. I think it's going to make massive impacts on preventative health and even healthcare spend
mhm.
because this is a very effective therapy. It's in terms of overall health. So it will stave off a number of the other downstream conditions that we are facing, and actually do so at a very low cost compared to what most therapies are doing today.
Right.
So I think this just fully mainstream is going to be one part. And then within that, the second bit is testosterone in females. This is going to be again right alongside. It's kind of there today if you look at, the discussions around menopause and how it's coming into play.
Mhm.
But again, more and more so people are going to realize how much of the equation it actually is.
Yeah. So are women now taking your oral, or is it kind of reserved for men at the moment?
So it's not approved for females.
Okay.
That's, individual clinicians' discretion to use. Again, typically female doses are 1/10, so that's a little bit more difficult to achieve
I see.
today.
Okay.
But we are pursuing a program for
Okay.
an
I want to be
actual
in it.
approved. Yeah, no, absolutely.
I
It's
want to be
it's
part
gonna
of
be
it.
fantastic.
But I also, so right now is your method of choice for women the creams? I know you're not a doctor.
Sort of. Yeah. I mean, I've seen firsthand,
All right.
how,
Well, if I was your
yeah.
sister, how would you tell me to take it?
Yeah, it would probably be a cream, or if you could stomach an injection,
Oh,
a
I love
couple times a
injections.
week.
I would do
Yeah,
that all the time. But you think that's good for women too?
it's fine. Yeah, again, but what you want to do is really have the the frequency as tight as possible, right? So if it's 3 times a week, that's probably where
Oh, I
a
see. So
really
you're
good
not
sweet spot.
going up and down.
Exactly,
Right.
exactly.
And is that more so you believe for women it matters or for everybody?
For
Okay.
everyone, and males too. Yeah,
Okay.
absolutely.
Now, to recap, I think part of the reason why people hesitate in even doing this because it's a pain in the neck to go see their doctor or whatever. And they've all moved to just meeting some doctor that they don't know online. So I just want to run through this. The first step is to get your hormone levels tested. What are the
Mhm.
ways to do that if someone's like, well, it takes me 3 months to get in to see my doctor, or I don't have time, or whatever?
The best way is to do it, yeah, through a telehealth provider. I mean, you have options online that are solely labs, so you can just get your comprehensive lab work done, and then from there you decide to either take it to your regular doctor or you can take it to a telehealth doctor. Or there are online providers that are comprehensive, right? They'll do your testing, then you'll meet with a clinician, and if it makes sense, you can get prescribed hormone therapy. So there are a number of people, I mean, players today, if you will. So the spectrum is pretty wide, but there
Uh,
are definitely good players
okay.
to
So for which
utilize.